Hello, my name is Chelsea Honrath, and I am a registered dietitian at Hoag Hospital in Newport Beach. The journal article I chose is The Effects of Low FODMAP Diet on Symptoms, Fecal Microbiome, and Markers of Inflammation in Patients with Quiescent Inflammatory Bowel Disease in Randomized Trial. So some background information, there is limited evidence that a diet low in fermentable, oligosaccharides, disaccharides, monosaccharides, and polyols, or FODMAPs, reduces gut symptoms in inactive inflammatory bowel disease. The purpose of this study, it was a randomized controlled trial to investigate the effects of a low FODMAP diet on persistent gut symptoms, the intestinal microbiome, and circulating inflammatory markers in patients with inactive IBD. Approximately 35% of patients with IBD experience gut symptoms despite having inactive disease. So what is the etiology? It's actually unclear, but it is hypothesized to relate to coexistent irritable bowel syndrome, or IBS, effects of previous GI inflammation on gut function, persistent, undefined, low-grade inflammation, the psychological impact of IBD, and the brain-gut connection. Persistent gut symptoms have a significant impact on the health-related quality of life in some of these IBD patients. So, attention to FODMAPs. Fermentable carbohydrates increase small intestinal water, creating an osmotic effect, or diarrhea, in the gut and colonic gas through microbial fermentation. Studies have shown FODMAPs can induce gut symptoms in both IBS and inactive IBD. Dietary restriction of FODMAPs is thought to improve functional gut symptoms by reducing water in the bowels, colonic gas, and luminal distension in those with gut hypersensitivity. So, some methods of the study. It was a single-blind trial of 52 patients with inactive IBD, both ulcerative colitis and Crohn's disease with persistent gut symptoms. Patients were randomly assigned to groups that either followed a diet low in FODMAPs or a controlled diet, and they did receive dietary advice for 4 weeks. They looked at and measured gut symptoms and health-related quality of life. Also, stool and blood samples were collected at baseline and end of trial. And lastly, fecal microbiome composition and function was assessed. So some methods continued. So inclusion criteria for the study. So patients that were older than 18 years of age, inactive Crohn's or ulcerative colitis, and those experiencing ongoing gut symptoms without any knowledge of the low FODMAP diet previously. Some exclusion criteria, so changes in IBD medication, the addition of antibiotics, probiotics or prebiotics, perianal Crohn's disease, a current stoma, a previous extensive GI surgery or resection or stricture, in addition to bile acid malabsorption, constipation predominant symptoms, and also those who were pregnant or lactating, and they also looked at other comorbidities. So intervention and control groups. So the individuals are broken up into 2 groups, either the intervention group, which was on the low FODMAP diet, or the control group, which was a sham diet. So basically an exclusion diet very similar in intensity as the FODMAP diet, but not affecting nutrient, fiber, or FODMAP intakes. Both groups, like I mentioned before, did receive 20 minutes of dietary counseling for both of the diets, and written information was provided. Dietary compliance to both diets was encouraged at weekly telephone calls. So results. Patients on the low FODMAP diet versus the controlled diet had greater reduction in IBS severity scores, had higher health-related quality of life scores. Although this difference was not statistically significant, it did show the greatest impact on bloating and distension, in addition to reducing the severity of flatulence and significantly lowering the daily stool frequency. Also, there was a lower abundance of the bacteria seen on the screen, which these were thought to regulate the immune response. And lastly, the microbiome diversity and markers of inflammation. so CRP levels and fecal calprotectin did not differ significantly between the two groups. So some limitations of the study is that the trial did include only 52 patients and the diet was only 4 weeks. A longer, larger long-term study would be beneficial, and probably the greatest impact was that the 4-week diet low in FODMAPs is safe, it is effective for managing intestinal symptoms not associated with inflammation in patients with quiescent inflammatory bowel disease. And that is it. Thank you so much.